Hello everyone, welcome. This is the sixth webinar of the series of webinars on resilience and transportation that we have been organizing. We at the German Agency for International Cooperation, also NUMO, N-U-M-O, and TUMI. My name is Victor Valente. I work at GIZ and I, alongside Carlos Pardo, will moderate this panel. In today's webinar, for the first time, we'll be having simultaneous interpretation. So those of you who do not speak Spanish can also take part in the webinar and can also listen to us. Before introducing the topic at hand and the speakers, I'd like to explain to those of you who do not speak Spanish what you can do to have access to the simultaneous interpretation function. So I'm going to switch to English and then I'll go back to Spanish. Una vez que escaneen el código QR, van a poder escuchar la traducción. Si están usando cualquiera de las dos opciones, por favor vayan a la opción de audio y den clic en ir al webinar. Van a tener que presionar este botón en la opción de audio y elegir la opción de no audio. De esa forma van a silenciar el webinar y van a poder escuchar únicamente la traducción en su computadora. Si están utilizando su celular como dispositivo para escuchar la traducción, entonces van a poder ver el webinar en la computadora. Por favor, estén pendientes del chat de la audiencia todo el tiempo. Ahí van a poder tener acceso a lo que se pregunte. So now I'm back to Spanish. I hope the translation service is working for you. If it's not, please write to us on the chat and we're going to try to support you. Today's webinar will be addressing a pretty relevant topic, which is how risky is it to use public transportation? We're going to have three experts talking about this issue. We're going to have three presentations that will last from 15 to 20 minutes, and then we'll have a Q&A session. We urge you to use the chat so that you can send all the questions that may arise. Go to the questions section within your dashboard, and there you can post all your questions, which will be sent to the speakers. As I mentioned earlier, my co-moderator will be Carlos Pardo. He is senior manager at Numo. He's also the founder of Despacio. Carlos will be moderating the Q&A session alongside the speakers. Carlos is also part of a group which is discussing these issues. This group is comprised by teachers, consultants, and researchers, and they delve into the epidemiological side of public transportation during this COVID-19 crisis. The first presentation that we'll be hearing will be given by Alejandro. He is an associate professor at the Civil Engineering School at the University of Chile. Then we're going to listen to Jairo Espinosa Oviedo. He is a tenured professor at the Automatic and Electric Power School at the National University of Colombia. Afterwards, we're going to listen to Andrea Varela. She is an assistant professor at the Medical School of the University of Los Andes and coordinator at the Global Observatory for Physical Activity. From now onwards, I'll give the floor to my colleague Carlos, who will be moderating the webinar up until the last section. Thank you very much. If you have any questions about the simultaneous interpretation, please write your doubts on the chat. Thank you so much, Victor. Thank you everyone for being here today. It's pretty cool having you, seeing all of these people who are interested in public transportation issues, who are wondering what's going to happen in the COVID-19 crisis. And as you mentioned earlier, we've also been working with people who have been focusing on these issues. I will move on to the following slide. And basically what we want to do here is answer this question. What are we going to do so that public transportation is not so overcrowded as it was originally designed for? But at the same time, occupancy rates should not be as low so as to raise financial issues or problems in the running of the transportation system, because it wasn't designed for having these issues. I won't talk much right now, but I will be jumping in when we have the Q&A session so that we can contribute to what each person is saying. But now I'll give the floor to Alejandro, who's going to talk about the transportation side of this all and who has been working on this for many years. He holds a PhD by the Institute of Logistics and Transportation at the University of Sydney. And he has been working on different issues related to transportation. He has also been working alongside GIZ on disruptive mobility, and he has been concentrated on talking about these issues. Alejandro, if you like, can you start, please? So you have 15 minutes to present. Alejandro, if you could please unmute yourself so that you can present. While Alejandro begins, I will be talking a little bit about himself. He recently published with one of his colleagues an article who assesses the different factors related to COVID-19 and transportation, and he's going to talk about the findings that they have gathered. He will also talk about how this thinking in terms of public transportation has evolved. Alejandro, We are seeing your PowerPoint presentation, but it's not on presentation mode. If you can please unmute yourself, that would be great. And if you need anything, I can help you too. Are you okay, Alejandro, over there? Are you ready to begin your presentation? We cannot hear you, Alejandro, so I'm going to unmute you. Can you hear me now? Okay, I was on muted mode, so that's why you didn't listen to me, but can you listen to me now? Yes, that's perfect. So can you share your screen now, please? And start displaying your presentation. Now we're looking at your presentation. Hello, everyone. Good morning and good afternoon. I thank Carlos for the introduction. What I'll be addressing today is a concerning topic, which is the role of public transportation during the COVID-19 crisis. As Carlos mentioned earlier, I have been working on this topic for some months alongside colleagues from the Dutch University. And we've been working and focusing on public transportation up until June 2020. We propose a series of research guidelines that we need in the following weeks because the data is advancing quickly, but we should try to improve our understanding on public transportation and its use during this period of crisis. I'll be sharing the presentation with you. I'll send it via the chat if Carlos hasn't done so. These are unprecedented times, and the situation for the public transportation system is not any different because governments have urged citizens not to use public transportation systems. So this is a health recommendation. Governments have issued different kinds of recommendations around the world, and there have been many extreme cases even, such as the case in the UK, because they have told people not to use public transportation without telling people what they can do instead or what the solution can be.
So they have to take charge of their problems without giving solutions, right? So we were talking about why it is so necessary not to let public transportation go away. Well, first and foremost, in order not to promote social inequality. So this is the first point that I want to make. In Chile, we carried out a survey. There are 2 rounds of this survey already. One was in the end of March and the second one was in July. And we asked people about their mobility patterns before and during the COVID crisis. And so what you can see in this chart is a comparison between the number of trips in public transportation and car commutes. So between the second week of March, which was the somewhat normal week, and the third week of March, which was the first week when the measures were adopted in order to contain the spread of COVID. So in this graph, if you see it from left to right, the number of income, the income percentage grows within these few months. So first and foremost, you can see that commutes in public transportation decrease in comparison to private car commutes. And you can also see that high income users are doing this the most. So during a pandemic, which are the populations that use public transportation the most? These are low income people who have no alternative. So people who have a higher income will prefer to use their own cars. So we need to implement safety measures for public transportation, and this is directly related to inequality issues, and this increases inequality further during the pandemic. So the second point is also that there was a significant decrease in demand for public transportation in many countries around the world, countries in every continent. And this, of course, will have financial effects. It will have a financial impact for transport companies that are about to financially collapse or go bankrupt. In Santiago, there was news about 86% reduction of an 86% reduction in the number of passengers in public transportation systems. And it's very important not to let this happen, because there are negative consequences for development, urban planning, and of course there is a massive migration to private cars for people who used to commute in public transportation most of the time to people who are just using their cars right now. So there was news in Spain as well saying that ever since June, the use of cars, private vehicles, has reached 80%, and it's double the use of cars is twice as much as public transportation. So people are using their private vehicles and walking much more than using public transportations. This is US data, this is Brazil's data. There are the same public transportation use trends that you can see. And well, these are the studies that have been carried out about the correlation between public transportation use and COVID-19. In April, an academic from MIT carried out some research that caused a lot of controversy around the world. And the conclusion of this research was that the subway was the main factor that helped the virus spread during the first New York outbreak. So these are headlines from newspapers in Argentina, US, and Spain. And the article is available for download in this website. The author of this research is Jeffrey Harris. He is a professor at MIT, and he is showing that there is a correlation between the substantial decrease in demand for public transportation and subways in Manhattan. There was a 90% reduction, and it's directly related to the increase in infections in New York. So the use of transportation was closely related to an increase in infections. So there were many blogs that heavily criticized this article because they defended the argument that the correlation shown by the author is not showing the whole perspective. Not all points of view are taken into consideration in this case, and so this argument could be considered to be biased. So what happened in this case, maybe it comes as a surprise for many and for others not so much, but when this study was published, due to all of these arguments, this counter arguments that were published, as you can see here, there was heavy criticism because this was published by MIT, which is a prestigious university. So this had a greater impact than if it had been published elsewhere. And we also must remember what the nature of correlation database studies are, because for many, there are even more studies that have been carried out in this subject in July, for instance, and they came to the conclusion that there is no evidence that commute patterns to and from work have a significant impact on the infection rate if occupancy is controlled. At the same time, this article states that closed spaces have a very important role, a much more important role, as well as populational density. Population density is also a very important factor that can help spread the virus. So the work that is being done during the pandemic is also closely related to the number of cases. So in the first sentence, we can see that there was a 1% increase in the number of workers employed in transportation, an occupation that has been declared essential and has a high degree of exposure to human interaction. So it has an increase in the share of positive tests by 1%. However, the length of commute and the use of public transport are not significant after controlling for occupation. Regression models were also used where this can be proven, but the point is to tell you that the percentage of public transportation commutes are always being monitored. And what I need to say by all of this is that correlational studies are not enough, because depending on the data that's available to us, we know that in some instances public transportation use is directly related to an increase in COVID cases, but in some others it doesn't really affect the number of cases that could be reported. So it all depends on the data sets that we're using. And we also know that correlational studies have their limitations, such as the one that I just mentioned. So there's a second type of analysis that is about traceability of contact. So this study was published in Japan. The headline is "Japan Ends its COVID-19 State of Emergency." And this was also a piece of news about a study that was being carried out at that moment, and it had not been published yet, but it was finally published in Science magazine. And the author's conclusion was that the traces of contagion, places where most infections happen, are gyms, parks, live music venues, karaoke places. So they all share the characteristics of being in enclosed spaces where people are exercising, maybe singing or moving. And actually, trains and public transportation vehicles were not deemed to be a high risk contagion spot. And the study shows that the difference between public transportation and the other places that I mentioned before is that people are using masks and they are not talking amongst themselves. This is completely different from a context where people are singing, dancing, talking to each other, and probably not using masks. So I think that this is very interesting, but there is a very crucial point that we need to take into consideration. If public transportation were such a dangerous option, Japan would have a much higher rate of COVID-19, and it actually doesn't. So another case like this, another study like this has been reported in Spain and Austria, and it all depends on the measures that have been adopted to control occupancy, the use of masks, cleaning, ventilation, and on the other hand, this also depends on virus prevalence in the population. So how high is the contagion rate, the infection rate in the population at that point? From the Japanese perspective, it is true that the super spreaders and the most cases happen where people are in closed spaces, crowded places, there are close contact settings, and public transportation, depending on the conditions, does not meet these requirements for super spreading. So people always need to use masks, of course. As I mentioned, the main idea was that the risk of infection is higher when all of these conditions are met. And it's very important to remember that out of all of the measures to reduce cases is the one causing more problems is a lack of social distancing in public transport. And it's usually very hard inside public transportation to ensure social distancing, because when it gets crowded, it's very hard to keep this 1 meter to 2 meter distance between people. So we know that universal use of masks actually works, and there will be more on this topic later. It's very important to have constant cleaning services in the trains, and of course, long distance commutes are riskier than short distance commutes. There are specific studies about COVID-19 that have shown that masks are efficient in preventing new cases. And when someone who has COVID-19 is using a mask, even if they talk or interact with someone who doesn't, but they're both using a mask, the risk of contagion is very low. And there was an article published in this magazine that you can see on screen where two researchers have reported a case where someone in the town of Chongqing in China got into a bus without wearing a mask. This person had COVID symptoms, but he was in a hurry. He got into the bus and he commuted for 2 hours and 15 minutes. And there were 29 people on the bus, and he spread the virus to 5 other people. So he had to switch buses, and he also wore a mask in the second trip, and in the second trip he did not spread the virus to anyone. So there were 5 infections when he was not wearing a mask and no infections when he was wearing a mask. And finally, there's this Singapore approach, and this is something that has not been very popular, and I would like to point it out here. In June, Lawrence Wong is the minister in charge of the task force against coronavirus, and he stated that social meetings will still be banned, because we know that the risk of infection is very high when people are interacting in close contact with each other, but it's very difficult to keep social distancing within public transportation. So in those circumstances where social distancing measures cannot be met, if people are wearing masks, people are not talking or talking on the phone, the risk will be extremely low. So this changes. This is different from the English approach that we mentioned before. It's important to explain to people why this is so important, and it is also important to explain how we can lower the risk for commuters. Thank you.
To get this right when it comes to public transportation, because we have to consider all the factors that I already mentioned, such as the social ones and the health ones. This has been very useful. Thank you, Alejandro. During the Q&A session, we're going to have more time to take a look at your information in greater detail while our following speaker is getting ready. I would like to tell you that there are several studies that have been replicated, and many people have published similar information. It's very important and very useful that you share the presentation with us. Something important that I'd like to mention is that we have to pay attention to the number of cases in interurban travel. So Jairo, please share your screen now. You can start now. Jairo Espinosa is a doctor in applied sciences. Jairo, we're seeing 2 Word documents. So I think that you should change your screen. I think you have 7 monitors here, so please go to the 6th one. Please share your presentation only. Now we're seeing your presentation perfectly, so I'll introduce you. As I was telling you, Jairo is a professor at the Catholic University of Belgium. He is a tenured professor at the National University of Colombia in Medellín. He is also part of the group that I talked about in the beginning. They have helped us understand the details on ventilation and the important role that it plays on COVID-19 containment. Jairo, whenever you're ready, you can start, and if you can turn on your camera, that would be great as well. Are you ready? Yes, okay. Thank you so much, Carlos. I'll be sharing with you a collaborative work of mine that we've been doing at a national and local level. We have tried to analyze 2 factors that have to do with the risk of contagion, and we have analyzed the environment and the factors around public transportation. As I mentioned earlier, we have collaborated with many institutions. As Alejandro mentioned earlier, we also conducted a correlational study because it's very important to take into account different factors. We took a look at the number of passengers that commuted around the city at a certain period of time, and we saw a trend that shows an increase. However, evidence doesn't tell us that this is the only activity that leads to an increase. This increase in the number of cases has also considers the opening of the economy. And if we conducted an epidemiological model, we should take into account the people who travel in public transportation. But I don't think that mobility is at fault for this increase. If we turn to epidemiological models, we would have information up until June the 20th. We saw some unidentified clusters. These are subway users shown in the graphs. In the worst case scenario, one could say that 4% of passengers may have been spreaders. But this is highly unlikely because we have already stated all the possible or potential causes for infection. We couldn't really trace patient 0 in clusters. So what we've seen is that the case is well below what people expected. If we analyze the infection rate in public transportation, we'll see that it depends on 2 factors: having someone infected on board a bus. In this case, we have to consider the number of cases in the city and the likelihood of these people getting on board buses and trains. And once this passenger gets on board, we have to consider the exposure that he will have to other passengers that are not infected. So we have to take into account these 2 factors. If there are no infected people, any distance is saved. In this case, we would be like in a pre-COVID-19 scenario, and you could have 100% occupancy rate. This is an exercise that we have conducted previously. And we said, if we have 6,000 people infected in a city, 289 people would be potential commuters. If all of them stepped into the same bus, which is a pretty extreme assumption, but if all of them stepped on the subway, we would have a probability of having 2 infected people. So the paranoia that we're immersed in when traveling in public transportation is unfounded. Because you're not expecting to see lots of people infected. The level and the number of cases is well below what we're expecting. And on a subway, we don't really see a high likelihood of having many infected people. These are the numbers that show us the likelihood of having someone infected traveling on a bus. So the level of risk is not as high as we had initially thought it was. 100% of these infected people do not get on the bus. Only 38% of them get on buses. Let's say that they are asymptomatic, and a very low percentage are in the initial stages of the disease. And once these people are diagnosed, they won't travel on public transportation, which reduces the level of contagion or risk even further. On this graph, we show the risk of contagion. We analyzed 3 contagion days. This data was shared by the WHO. And lastly, we have analyzed the literature. There was an article that was published in June and shows that the level of contagion shared by the WHO is exaggerated. Although we're not saying that we should not pay attention to the people around you when you're traveling on a subway. The riskiest way of getting infected is through droplets, through large droplets that are larger than 5 micrometers and that can be expelled through exhale. They can get out of your mouth very easily if you are not keeping your distance from other people. There are also small droplets, which are smaller than 5 micrometers and that can travel in exhale. This wasn't recognized by the World Health Organization before, but nowadays this is recognized as a way of spreading the virus. And obviously, the takeaway message here is that we shouldn't have recirculating air conditioning. The effect of keeping a distance is very important. There is a study that was conducted in 6,000 patients who had MERS and SARS. This is, in fact, a collaborative study that takes into account 24 studies and tells us about the total risk of getting infected on public transportation. So let's analyze a case of someone who has low defenses and who's standing at a subway carriage. That person has a 10% risk, but a healthy passenger has an even lower probability of getting infected, which is closer to 0. If we see the effect of a non-medical mask, we see that it can have a 50% rate of protection. If only one person uses this face mask, the contagion risk would lower to 20%, and he could even get closer to someone and could not abide by the 2-meter distance measure. We've also seen the effect of exposure time. This graph shows a contagion risk of 0%. It is pretty low, as you can see. And what this shows is the effect that the virus has over time and the distance that the face mask can allow for us to have. In this case, we're talking about closed spaces without ventilation. So this can be a way to talk about distance and how we can flexibilize the 2-meter distance that is oftentimes recommended. If we analyze the travel time, we see that the longest trip was 20 minutes only, but people travel on average 16 minutes, which gives us relatively low travel times. We have also conducted occupational studies. There are some occupations that require longer distances to be traveled, but if we decrease the occupancy to 55%, we would have a 45 to 55 centimeter distance between passenger, which is quite safe, given that every person should wear a face mask. Now, when it comes to the mitigation of aerosols, this is a quite challenging topic in the sense that we're talking about tiny particles, but they could travel in very long distances. So we should see how we can mitigate aerosols. The most important thing here is that passengers should travel in silence. If we talk for 4 minutes, it's like we were sneezing for 34 minutes. How can we mitigate aerosol? So we should take a close look at the first C I mentioned. We should have transportation systems with ventilation. Because the virus and the droplets that the patient expedes will be limited to his own surfaces, to the surfaces around that person. Why? Because the subway system has a vertical ventilation system. It ejects air from the top and it stays that way. It's important to analyze the geometry of the ventilation system. If we didn't have this, the space would be filled with the droplets and with infected material over a short period of time. So it's not only important to take a look at the ventilation, but the amount of droplets that we see. The air within the subway is renewed within 33 seconds. The air is totally renewed in around 50 minutes, which means that it is renewed 4 or 5 times within the same trip. So we have an occupation rate of 55%, and we see that if we have an infected person, the people around them do not face high infection risks because of the ventilation system. We also analyze the tram. Trams renew the air every 50 minutes. Something interesting is that commuters travel around 10 minutes in these vehicles, so the travel time is not that high. The air renewal system is a top-down type of system, such as the one we see in the subway, but it is less efficient. In the case of conventional buses, which are small buses, they do not have a proper ventilation system, which means that the speed of the vehicle determines the amount of air that gets into the vehicle. There is also another negative factor that the air moves around in a turbulent way, and the travel time is of around 20 minutes. That's why we have forced them to have proper ventilation. We've also conducted some simulations that talk about forced ventilation. Here we can see the effect of the forced ventilation that we are requesting them to do. If we analyze this type of vehicle, a BRT, we are going to get this data.
Circulation in the superior part, and that's also a horizontal system, which is not ideal, but there is also air renewal every 10 or 15 minutes. So this is what we can see in this graph. And finally, but very important as well, is to remember that this ventilation system needs certain mechanics and also cleaning. So there needs to be cleaning before, during, and after. Before, and the stairs, for instance, the non-contact payment systems, a constant cleaning, constant cleaning of all of the rails and all of the handrails that people use in the stairs. So this is done multiple times per day. It's very important. And the hand washing stations and also antibacterial gel needs to be available for all of the users of public transportation systems. So this is a sustainable use method where, of course, if the number of infections increases, occupancy will decrease, and if number of infections decreases, the other way around, we will promote the use of a public transport with a higher occupancy as long as it's possible. So you can see all of this information on slide, but first of all, we need to calculate the number of infections, then define how the route should be laid out for those areas where most cases are happening, and then implement all of the measures that I told you about in these routes. So it's very important to keep clean surfaces. So, in order to avoid spreading of viruses in public transportation systems, all surfaces need to be clean. All of the users need to have access to hand washing stations and gel stations as well. You need to wear a mask that properly covers your nose and mouth. That is crucial. There should be no talking, and you should breathe while your nose and mouth are covered by the mask. Your nose should not be outside of the mask, and of course, people should not be not be eating or drinking anything in public transport. We will give preference to vertical flow, and of course, the air needs to be constantly renewed to avoid a high rate of infection. So, we should not have any turbulent flow systems. Sustainable transport depends on system management. We need to have constant control. All of the drivers need to be constantly carrying out all of these cleaning measures. And that is how we can control the pandemic, because there will be multiple waves, multiple cycles, and occupancy of public transportation needs to change constantly, and it will always depend on the rate of infection in a city. So I would also like to thank the team that has worked with me on this project. And well, thank you for inviting me. There are many new concepts for people here. If they work in the transport sector, when we started looking at all of this information, those of us in the transport sector found all of these insights very interesting, because we had never thought about ventilation before. So there are many new things that we need to start thinking about, like setting standards for ventilation in our countries and trying to use these ventilation systems in a different way. So during the Q&A session, we'll probably answer some of those questions. So meanwhile, while Andrea is setting up her screen, I would also like to tell you that we are reading through the questions that you're posting on the platform, and many people are asking about whether or not this session will be available or if it's being recorded, and the answer is yes, it is being recorded, and all of the slides and the webinar itself will be available for watching it later. So I would like to introduce Andrea Ramirez Varela. Andrea Varela is the name that was published all around. So I think Victor is just thinking in Portuguese where, they used her second last name as the main last name, so that's why we use that last name. And she is an expert from Brazil. She's also working in this case in coordinating the Global Physical Activity Observatory, which is the GOPA, and of course she is going to talk about the findings that her group has been working toward discovering in Bogotá, Colombia. And she is also a faculty member at the University of Los Andes. Okay, so first and foremost, good morning, and I would also like to thank Carlos Pardo for his leadership and for sharing the results of our collaborative group in this webinar, for providing this opportunity for all of us. So I would also like to thank all of my fellow panelists. Today I will talk about Bogotá's experience. From the outset in this pandemic, we have been trying to analyze what the situation would be like for public transportation in Bogotá. The main system is called Transmilenio. First and foremost, I would like to thank all of my colleagues in the GOPA, and the results that I'm about to present are basically the conclusions that we have reached ever since we started working in the beginning of the pandemic in March here in Colombia. So since there was a very important need of working in pandemic contention and trying to lower the new cases as much as possible, were public health measures that have been implemented. And in Bogotá, for instance, one of those measures was reducing public transport occupancy by half at least. That was a recommendation issued ever since the initial stages of the pandemic in Bogotá, with the purpose of reducing risk of infection. So, as Alejandro and Jairo have previously mentioned, all of the scientific evidence that we had before about respiratory diseases showed that the use of public transportation helped spread the infection or the virus because there was a high density of people, there was no proper ventilation, and then healthy individuals were being exposed to people who were infected during long journeys or long commutes. So in Transmilenio, we have a high number of users, and as I said, this is one of the biggest transportation systems in the country. So in our modeling group in Colombia, we started trying to answer some of the most important questions that help us make decisions when it comes to public health and public policies. We wanted those decisions to be made in a timely manner so that they could meet the needs of the population and stop the infection. So we tried to answer the following questions. The first one was, what are the recommendations for use of Transmilenio during the pandemic in Bogotá? And the second one, what are the time patterns and what are the social and demographic inequalities in the use of Transmilenio during the first 4 months of the pandemic, according to the mitigation measures implemented in Bogotá, and before the quarantine, during the quarantine, and a flexible or staggered quarantine. So since we started working from the initial stages, as I mentioned before, we wanted to establish what was going to happen in the future and foresee the potential results. So we had a very clear quarantine period set out for us, and then there would be future quarantines based on everything that happened after. So before there was a very rigid, a very strict quarantine, and after it turned into a staggered or a partial quarantine. I am going to use the following dates to explain what results we reached. So on March 6th, we diagnosed the first COVID case in Bogotá. It was also Colombia's first COVID case. And on March 20th, we did a quarantine drill in Bogotá. So we did not fully impose a quarantine. There were quarantine drills for the first few days, and the mandatory quarantine started on March 24th. So in May, we started a flexible quarantine, and there were people who could go outside under certain conditions, maybe if they had to work or there was anything else that they had to do outside. So I would also like to thank our data sources. We would like to thank the Transmilenio network and Bogotá's authorities because they provided all the data necessary to do this analysis. So first of all, we wanted to figure out what was the number of users from the Transmilenio system ever since March 2nd. We calculated the validation average, and because we have a short period of time for this presentation, I would like to go straight to the results. So during this period, there was a reduction of over 70% in users of all of the stations of the transportation system in the city, and there was a very small percentage of stations that was only reduced by 70 or 80%, most of them reduced by 80 to 90%. So it's very it's very important to show you a chart so that you can understand what all of these figures mean. So I would also like to thank our map maker, chart maker, and the University of the Andes group that is in charge of creating these charts. As you can see in the upper part of the screen, in March 2nd, there were no cases in Colombia. So this was what the transportation system looked like. We have all of these Transmilenio stations, and here we have a very important part of the town, which is called Hotel de la Ciudad. So this is north of the city, this is the south of the city, this is the east and the west. And this is peak hours. So purple is the morning and the other ones are the afternoon. So this is a critical day, a typical day actually in Bogota. And this is what has happened after the quarantine was imposed. This was the first diagnosis that we carried out. So here you can see that there is a great reduction in the occupancy rate, as I told you before, until March 20th. This was a quarantine drill. There's a significant reduction. All of these stations in red, as you can see, still have a substantial number of users going through them, but you can also see that there was a very significant reduction by March 24th. March 24th was the beginning of the mandatory quarantine, and it looked very similar to March 20th. But here, after just a few days in the mandatory quarantine, there was a growing downward trend in users in all of the stations. Although there are some stations that still have high frequency or high occupancy if compared to the initial stages of the pandemic. So this map has been zoomed into a little bit so that we can better understand what were these stations that had lower occupancy in comparison to others. When you compare financial or social and economic status to the occupancy, where you have the lowest income in the 1 and 2 areas, the reduction was lower in comparison to other previous periods and other stations around the city. And this is also the case when you compare commutes within the city. So from residential areas to commercial areas in the city. We will look at that later on. So if you take population density into consideration, the results are obvious. Where there was less than 70% reduction in occupancy, this is where the population density is higher, of course, which is why there were more people in public transportation, and people have a lower income in comparison to the rest of the city. So population density is 1,000 inhabitants per square. So as you can see here, these are the areas where the reduction in use of Transmilenio was lower. And this is also related to what Alejandro mentioned before. There are some
people who need public transportation to commute, but we have also seen the reflect of the great informality in the work that people conduct in the city. These are people who need to work and who need to keep commuting, and these people are facing major risks. There is correlation to land use as well. And this has to do with what I mentioned earlier. In general, when you look at the map at the areas that are highlighted in yellow, these are residential areas. And areas highlighted in red or purple and darker purple are commercial or industrial areas. So this is what you can see in the city. These are the findings of a mobility survey conducted in 2019, and we can see here that people go to commercial areas and then go back to where they live. This has reflected why some stations aren't able to reduce as much the occupancy rates. The highest reduction was seen in the highest strata, 4, 5, and 6, where there is low population density. the pandemic started in a neighborhood which holds the highest socioeconomic status because these people were able to travel and import the virus from elsewhere. I wanted to show you a video that summarizes a little bit what happened in the city when comparing these points over time. We're comparing February 21st and May the 21st. You're going to see that these dots will turn red, which indicate that the occupation was lower than 50%. These are the validations in 15 minutes throughout different times of the day, from 4 to 11 a.m. You can see here a normal day, February the 21st. So these are the stations that have incredibly high occupancy rates in terms of percentage. And then you can see May the 21st, and we see no red dots in occupancy rates after COVID-19. We can see the times of the day from 4 a.m. to 11 at night, and we compare different times. The blue line is the pre-pandemic line, the green line and the yellow one correspond to the strict pandemic, and the green one corresponds to the number of trips where there was a more flexible pandemic. And we also have here a date, which is something that we have called the COVID pre-day. And in this day, there were sales without value-added taxes. So people went out and started shopping, and that's why they went outside. Here we can also see another line that Alejandro showed before, and it compares the number of accesses to the Transmilenio system with other sources of data. In this case, the data comes from Google Mobility in terms of public transportation numbers. On March the 1st, we can see a very high number in the use of public transportation. The maximum validations were what we call 100%, and from then onwards, they start decreasing to 80 or 60%. Dates are also important here. This point marks where the WHO declared the pandemic. Then here we see when the national government declared this a national emergency. We see the mock quarantine, and then we can see the fluctuations of public transportation use up until August the 1st. Of course, the validations reported by Transmilenio are lower because public transportation has been used less. We compare these data with Google Mobility, and we can see that the numbers are kind of similar, although the use of public transportation has been lowered dramatically over the last months. This data comes from the Transmilenio information database, and we see that there was a decrease in the use of transportation system of 80%, especially if we compare it to the same period but a year ago in 2019. You can see April 2020 here. There were 17 million validations in this period, and in April 2019, there were more than 80% increases in this. So first of all, we distributed the scheduling of the routes so that there can be more buses in areas where there were lower reduction rates, meaning that there were more people using the system. We also incentivized strict physical distancing, hand washing, and the use of face masks. We also promoted spread working hours to reduce congestion in the access to public transportation stations, and we also recommended that people remain seated, leaving a seat between them and other passengers. We also incentivized the use of other alternatives, such as bikes, and of course, walking. This goes hand in hand with what Heido presented earlier. I'm about to finish, so just 1 minute. This is related to what Heido mentioned earlier, and those are very important recommendations for our self-care, but also to take care of other people within the public transportation system. So Heido already mentioned this. And lastly, I would like to tell you that the town council conducted a survey with users of the public transportation system in the city. And this is one of the most important findings that we should not just take measures inside the system, but we should also educate people so that they can understand what measures are truly effective to protect themselves. We were comparing different days, July the 3rd, for example, and it is expressed in the red bars. So we can see that people were already using face masks, for example, although hand washing and physical distancing were adopted in lower rates. You can see that the adoption rate of these measures is quite low compared to the measures that the town council has announced. Only 33% of the users think that they can get infected by coronavirus. There is a great myth around the fact that maybe COVID-19 is not a reality and it's a myth. And that has an impact on the behavior that people have within the system. To conclude, I'd like to say that this shows how we can prevent ourselves from getting infected in public transportation. And one of the ways in which we can do this is to educate ourselves and other people. We should also analyze what are the effects that the use of private car would have on ourselves, such as a sedentary lifestyle, physical inactivity, and what is the effect of private cars in air pollution. Thank you very much. Thank you, Andrea. This is a great way to wrap up with the 3 presentations because we were able to see in a greater scale the questions that we have right now. I'm going to show a summary of what you have said up until now, and I'll try to find a common thread between the 3 presentations. So after this, we're going to start with the Q&A session. Jairo, Alejandro, and Andrea, in the meantime, can check the questions that we have on the chat so that you can get ready. First of all, you talked about what we can do to understand the measures that we have to take in public transportation, and then what we can do when restrictions are lifted and how we can change the operations. It's important here to find a middle ground between these 2 scenarios over time. There are some recommendations that specifically analyze the group that we were mentioning. And these sentences summarize what you guys were saying. So what is important here is to keep quiet, use a face mask, and have proper ventilation. If we have these 3 factors, everything will be all right. So face masks should be used throughout the trip, and people should enter the system in an orderly way. You should also wash your hands constantly and keep a distance, a safe distance. I started to work on something while you were talking, and I outlined the decisions that we must make based on what we are seeing in the systems. And I also analyzed how these ideas can be reflected in concrete actions. Of course, physical distancing is important, but we can decrease the distance if our behaviors are correct, are appropriate. But if we do not abide by these measures, then the distance has to be greater. And we have to see what we can do in this case then. I'd like to see all of you on camera so that we can have a Q&A session in the remaining time. So please turn on your cameras, all of you, Jairo, Alejandro, and Andrea. I saw that there were many questions related to ventilation. I think that's really interesting. Before Jairo explains more about that, I think that he can talk about air conditioning and what happened with the opening of windows, for example. I know that Jairo was delving into this topic, so he can answer more about this. I know that you were doing more work in terms of tracing, but there are questions related to what the message to the citizenry should be like. And what can we do to come up with a public policy that respects all the epidemiological measures and recommendations, but at the same time addresses the public transportation issue? So I'd like to give the floor to Alejandro so that he can talk about his point of view and tell us what he thinks about the issue. On what you said, I think that that's something that we're missing in our country to strengthen the message that risks are minimized if we adopt these measures. This is something that we have been discussing for long in the forum, the use of face masks, for example, the fact that people should not talk among themselves. And these are some of the recommendations that some countries give. There are some people in Latin America who step on the buses to sell or to even preach at times, and of course, that comes at a cost. Public authorities should ban these kinds of activities because silence is vital as well as ventilation. And this is something that's missing here because from March to April, people were told that public transportation is risky, period. There was no conversation around it. But I think that we have been debunking that myth in a way. And now we are counteracting the effect of these statements. But I think that the counter action is oftentimes less powerful as the offense. So we need to work on getting to people in a better way. And I think I don't have an answer for this question because there are many people that have decided not to use public transportation anymore and that won't turn back to it in many years because they have opted for their private cars. So we are in a stage where we're trying to control damage.
Do you want to talk about this point any further? Sure. I think this is also similar to the reasons why we should remain in mandatory quarantine or not. Basically, what Alejandro has been saying is that a message about not using public transportation has been sent continuously. However, I believe that these measures are not really focused on identifying people who are infected and that need to self isolate. It's not helping in any way. And it's also very important to understand that there are people who cannot forego public transportation. However, users need to understand prevention measures and need to understand why they are important. So it's no longer useful to say that mandatory quarantine is the only answer to this problem. There are people who will keep using public transportation, and there are people who will have the virus and they will still use public transportation because it's the only means of commuting that's available to them. So it's very important to really identify which are the most critical groups that need to obtain information about this. And of course, we need to have contact information of all the people who are reported to have COVID. There needs to be mask use, hand washing. All of those measures need to be abided to. So I think that's one of the success stories from Transmilenio, because Transmilenio was a system that first implemented awareness campaigns and educational campaigns for its users. So those are all the people who cannot stop using public transportation right now for some reason. I would like to add something to that. In fact, because interdisciplinary work in this very specific case, now that we are involving the transport sector with technology projects, I think that there is a very interesting perspective, and there are enriching insights that can be gotten because we have different interpretations of risk. We have a different attitude towards risk and a different reaction to it. So in the transport sector, we don't have a medical view of our actions, while in other sectors, we are always looking for the highest level of precision, highest level of probability of something happening. So I think that discussion, that multidisciplinary discussion, has been extremely interesting. And it's also very important to explain to the governments and ministries of transportation and health why these measures need to be implemented. And it has taken negotiation skills as well. So we have learned about their concerns, and we have also shared our concerns to help people who need to go to work by using public transportation. And we should never lose hope in the system. I don't think the population should lose hope in the system, but at the same time, we need to prevent more infections. So now I will give the floor to Jairo. I think you have read through many of the questions. Maybe you could go into more detail about this topic, because I believe that social distancing has been explained already, but it's also important to remember that it's not the only factor that's important. So how could we blend all of our knowledge? How can we take all of this into consideration? Ventilation is a new thing that we have been digging into and researching. So I think that maybe you could explain in a more detailed way how the ventilation system should work and talk to us about the standards that are in place. I know that there are countries where they have been trying to find very specific issues that can be improved in the ventilation system. So go ahead, Jairo. You are muted, Jairo. It's important to consider as a communication tool in the reactivation period to explore the 3 C's. They are C's in Spanish that stand for confined, closed. So we need to try to avoid those 3 C's that represent risks in public transportation. So when we talk about the responsibilities of those involved in the system, we say that the closed spaces can be mitigated by having proper ventilation. And this also depends on the characteristics of the vehicles themselves. What can the user do about this? Well, they need to issue recommendations for transport systems to create standards during the pandemic, right? Here, I told you that we reached ventilation standards for massive transportation systems where the rate of air renewal in this case should be 15 cubic meters per passenger. That was the renewal rate when we had fresh air ventilation. When using air conditioning, renewal should only be 20% per hour. That means that an AC system will renew the air every 5 hours completely. So that is a high risk. That means that air conditioning systems are a risk because air is not circulating before 5 hours. So passengers are using vehicles where air is basically trapped. And that is the consequence of having air conditioning systems in place. We need fresh air to come in, and we need air that has already been breathed into to go out of the vehicle. So that's one side of it. Then we have the passenger responsibilities that need to be fulfilled. They need to use protection equipment. That's basically the mask, nose and mouth mask, and they should not be talking inside of the vehicles. That's passenger responsibility. And then third, we have the operator's role. And the operator of the transport system needs to keep occupancy rates down to a certain level, and that will help to recover trust in the system. And of course, there are multiple possibilities of consequences that could happen in these cases. So for the unidentified clusters, it has been very hard for us to know if people were infected in their workplace or in a vehicle or inside their house, in a restaurant. It's not clear to us where they got the virus. So that is why it's so important to prioritize traceability in order to know where these infections are taking place. So now that you mentioned ventilation, air conditioning, we should remember that AC is the least favorable option. The most favorable option is to have fresh air coming in to renew the air within the cabins or the wagons. And where there is an air conditioning system, the recommendation that we're making right now is to try to close recirculation systems as much as possible and open the option for fresh air coming from outside. I would also like to take advantage of this intervention to briefly answer one of the questions that came up about the systems that are in place that have not been proven efficient in the face of COVID, SARS-CoV-2, which is the name of the virus. So there is no conclusive evidence for any new systems that can be used within vehicles. Okay, I think contact tracing and traceability are key issues. I found them very interesting. I don't think we had enough time to talk about that, but we still have 6 minutes. So I would like to answer one of the questions that came up right now about informal transportation. I would like to briefly point out that this is a very high risk of forbidding access to public transportation because there could be alternative transportation options that are probably not regulated. So that is what we're calling informal transportation right now. What do you think about this, Alejandro? Well, rules should apply to everyone. That's very important. Rules regarding ventilation, awareness, that is a very big challenge in our countries. There are countries that have very high level of technology in the transportation systems, but in other countries there are old systems that can also affect people. So drivers, for instance, have to also be aware of how to properly ventilate the buses that they're driving, and that's basically what we could do to minimize risk in those type of vehicles. Carlos, can I say something? Well, I would like to share our experience, our group experience, and our relationship with the transport ministry with Silvana Zapata and Carlos Dario. Well, one of the lessons that we have learned through that collaboration and through that partnership with decision makers, precisely because they are the ones regulating informal transportation through a legal pathways and government measures, it's very important for academic groups and for civil society groups who deal with those issues and try to find solutions for them to forge partnerships with the government and to have partnerships that will have an influence, will have an impact on the decisions being made by the authorities. And all of this work needs to be evidence-based. So we have carried out many meetings and conferences about this. Our spokespeople have participated, although I have not personally been there. But the authorities have been very opening to receiving recommendations from the working groups. Okay, thank you very much. I am going to put up Victor's screen so that he can make the closing remarks. So Victor, you can share your screen as well. Okay, Carlos. I'm here. Okay, we were able to put up the screen that we wanted. Well, to close, I would like to first and foremost thank Andrea for bringing all of us together. Andrea Ramirez, Alejandro, Jairo, and Carlos, of course. And I would like to say, as you can see here on screen, that this will be a series of webinars that are being coordinated by our TUMI and Euroclima groups. For Euroclima, we have a platform for sustainable urban mobility in Latin America. And in order to access this platform, you only need to click on the link that is on screen right now. You need to fill out a very brief registration form, and then you will be informed about all of the events just like this one that will be taking place in the future. They will be published in our website. There will be discussion groups. And of course, I'm also including the panelists in case you want to participate. And if you have any questions, you can get more information in the chat. And Carlos, can you go to the next slide, please? At TUMI, we also have a quiz where there are specific questions on this webinar. So if you are interested in taking this quiz, you just have to go to this link that's also on the screen. Mobilize Minds is a channel for learning where on a weekly basis we are publishing new content, and you will find a list of our future webinars at TUMI. All of this information can be found on the chat as well. So I believe this was a very productive webinar. It was very interesting. It's a shame that we can't spend more time discussing this. But I would also like to thank the translators. The simultaneous translation worked very well because I was also listening to the translation at times. I believe it was a great success. And now we are ready to go. We are going to have this webinar available on our channels, the TUMI YouTube channel and our website as well. So you can basically just access the information through those different channels. Thank you so much. It was a pleasure being here, and let's keep in touch. Thank you for your time and thank you for the opportunity. Thank you. Goodbye. Thank you. Have a good day.